Good evening, folks. This is Dr. Paul. Thank you very much for tuning to my channel today. Today I want to talk a few minutes about Giardiasis, a very common problem. Giardiasis is a protozoal infection of the upper small intestine. It's caused by the flagellate Giardia lamblia. It's also called Giardia intestinalis or Giardia duodenalis. This is a parasite you will see almost around the world, and especially in areas with poor sanitation, developing countries. The young children are usually infected. Now in the United States and Europe, the infection is the most common intestinal protozoal pathogen. So it's important to remember this. In US, for example, I saw many patients, even hospitalized patients. So especially people who visit these Giardia endemic areas, who swallow contaminated water during their trip or some wilderness travel. Also, men who have sex with men and people with impaired immunity, and people who are in a household with an outbreak, and also children's daycare center, residential facilities. They are all at risk for this infection because comes through water supplies, contaminated water. The organism, it goes in the feces as a flagellated trophozoite and a cyst. But only the cyst form is infectious by the oral route. So that's an important point. Only the cyst form carries the infection. The trophozoite forms are destroyed by the gastric acidity. Now humans are reservoir for the pathogen, and dogs, cats, beavers and other mammals, they have been implicated, but there is no confirmed evidence. So under suitable moist, cool conditions, you will see these cysts surviving for long times, even for months. And the cysts are transmitted as a result of fecal contamination of water or food supplies, or also even person-to-person contact, or also sexual contact, especially oral to anal to oral sexual contact can carry the cysts from one person to the other person. And the infection dose is low. I mean, as few as 10 cysts can give you the infection. And the trophozoites, when they go into duodenum and they emerge and they cause epithelial damage and mucosal invasion. People with hypogammaglobulinemia, low secretory IgA levels in the gut, achlorohydria, malnutrition, they are especially at a higher risk to get Giardia. Now, let us see symptoms and signs. 50% of people will have no infection. And 10% of people are asymptomatic cyst carriers. 25 to 50% of people develop acute diarrheal syndrome. So you say, not everybody develops symptoms. And this acute diarrhea many times is followed by chronic diarrhea. The incubation period could be 1 to 3 weeks, but maybe longer. That's an important point. The incubation period is 1 to 3 weeks. So if a person comes back from another country today, he may develop symptoms after 3 weeks. So you need to ask a very good travel history in these patients, even within a month or 2 months. So where did you go in the last 2 months? You need to ask that kind of questions. So in many people, thankfully, it is self-limited, but sometimes the acute diarrhea is followed by chronic diarrhea. Many people have profuse watery diarrhea, resulting in dehydration, especially in children. And many people develop chronic diarrhea. They develop abdominal cramps and bloating and flatulence, nausea, malaise and anorexia, fever and vomiting. So different kinds of symptoms can come. Diarrhea is usually limited in the self-limiting, but sometimes it can cause greasy, frothy, foul-smelling stools. But you don't see blood, pus or mucus. Diarrhea could be daily or recurrent. Sometimes it can come with diarrhea, constipation in that sequence. People develop weight loss. And because of the chronic diarrhea, some people develop malabsorption, fat and protein losing enteropathy, and even vitamin deficiencies. So you see, Giardiasis commonly happens in endemic regions. Cyst forms are infectious. 1 to 3 weeks incubation period results in diarrhea. Sometimes it is self-limiting. In the next video, I will be talking about the lab diagnosis and treatment. Please watch that video also. Have a good day.